Hello, my dear friends and my dear couples. I'm Dr. Leena Yadav and I'm an IVF expert, a fertility expert, or you can also call me a reproductive medicine expert. So when you come to me for a fertility treatment or you go to any other fertility expert, a fertility expert would also always tell you that please come to me on day 2 or 3 of the menstrual cycle. When we call you on day 2 or 3 of the menstrual cycle, we mean by that your ovary and your uterus are standing at the baseline. We can start any fertility treatment or a cycle from that baseline. So here I am today to discuss with you about a scan, what we always tell to all our couples, whether they come to us for ovulation induction cycles, or they come to us for IUIs, or they come to us for an IVF cycle. This scan is very important and it gives us a lot of insight, and here I am to tell you that what actually do we judge with these scans. You might have always heard that your doctor tells you that we will do a follicular monitoring scan. It is always advised on the prescription. So what is a follicular monitoring scan? What all do we see in that? And what is the significance of this scan? A follicular monitoring scan cycle includes 5 or 6 scans during a course of 15 to 18 days, starting from day 2 or 3 of the menstrual cycle. A follicular monitoring scan, when done on a day 2 or day 3, what parameters are seen? So we see the ovaries. When we see the ovaries, we see that there should be no cyst in the ovary, there should be no dominant follicle on day 2 or 3, there should be no corpus luteum on day 2 or day 3. We see the antral follicle counts of both the ovaries. If the ovaries on day 2 or day 3 of the menstrual cycle show a cyst or a corpus luteum, or it shows a dominant follicle, a fertility cycle cannot be started. The ovaries have to be on baseline on day 2 or 3 of the menstrual cycle. So that is your first follicular monitoring scan. On the first follicular monitoring scan, we also assess the uterus. When we assess the uterus, we see the position of the uterus. We also see the thickness of the endometrium. The thickness of the endometrium has to be less than 5 mm when we start a follicular monitoring cycle and any fertility treatment further. After this, if you are filling up all the parameters of this follicular monitoring scan on day 2 or day 3, the doctor starts the medicines or the injections for you from day 3. Now these injections, they go on for around 12 to 14 days, and the sole purpose of these injections, what we also called as gonadotropins, is to make the eggs. We also make eggs with oral stimulating agents. Not necessary that all the couples would need injections from day 3 of the menstrual cycle. There are many other parameters which are seen, and based on those parameters it is decided that whether we stimulate you with oral agents or gonadotropins. Now the doctor gives you medicine for 5 or 6 days, and again the doctor tells you to go for a follicular monitoring scan on day 8 of the menstrual cycle. When we do a scan on day 8 of the menstrual cycle, the parameters which are very important to us are now to see a dominant follicle. By dominant follicle, I mean that this is the follicle which has an oocyte inside it, which is maturing and which will be available for us for the fertilization. So it is important for us to see that based on our medications, how many dominant follicles are we getting? The number of dominant follicles are different in different treatments. We focus on 1 or 2 follicles in IUIs, and we focus on many more follicles, maybe 8 or 10 or 12 when we do IVF cycles. So day 8 of the menstrual cycle, a dominant follicle should be coming, and we also see the endometrial parameters. We see the thickness of the endometrium, we see the grade of the endometrium, we also see that the flows, the blood flows are reaching up to the endometrial layers or not. So this day 8 of the menstrual cycle follicular monitoring scan gives you a lot of insights. If till day 8 of the menstrual cycle you do not have a dominant follicle, then the doctor becomes worrisome and tries to maybe change your medicines or tries a different protocol. Now, if you you have a dominant follicle on day 8, the doctor again tells you to get a repeat scan done on day 11 of the menstrual cycle. When we do a follicular monitoring scan on day 11 of the menstrual cycle, the dominant follicle should have been grown by that time up to maybe 14 or 15 mm. The endometrial thickness would have been grown to about 6 or 7 mm, and you also see the other Dopplers and the other parameters around the ovary and the endometrium. So these follicular monitoring scans, they give you a lot of insight. Now after this, the next step is that we again repeat these follicular monitoring scan on day 12 or 13 of the menstrual cycle. Now here, when we are doing the scan, we need a good follicle which is around 18 or 19 mm, and this suggests to us that this is a follicle which would be giving us a maturing oocyte which has the capacity to fertilize with the sperm. We also see the endometrium which we want to be between 7 to 10 mm. Any endometrium which is 7 to 10 mm on a follicular monitoring scan is a fertile endometrium and has got a good endometrial receptivity for the fertilized embryo. We see the vascularity in the endometrium which should be going to the deeper layers of the endometrium. We see the grade of the endometrium. If the grade of the endometrium is not good, we become worrisome and we add on some medications to increase or to improve the grading of the endometrium. Mostly you cannot do much about it, but yes, you can medicate or change certain types and protocols which can have a good impact on the endometrium. The way a follicle is important, an egg is important, so is the endometrium. By day 13 or 14 of the menstrual cycle, when the follicle is absolutely mature and has a mature oocyte inside it, we introduce a trigger. So these follicle monitoring scans are very important for us and gives us a lot of insights, and they are very important on every day of the menstrual cycle which I have mentioned. They have got different value on day 3, day 8, day 10, day 12, day 14. There are many doctors who will introduce an ovulatory trigger. By trigger we mean that we give you a shot, and this shot helps us to rupture the follicle which we have made inside you. We rupture the follicle when we are planning treatments like ovulation induction cycles along with the timed intercourse, or we are planning a treatment of IUI. So we need to monitor this follicle and see that after the ovulatory trigger, whether this follicle has ruptured or not. If the follicle has ruptured, we plan the timed intercourse or we plan the IUIs around the follicular rupture, so that there should be an oocyte inside the uterus when we are introducing sperms into it. So much is important about a follicular monitoring scan. My dear friends, when your doctor repetitively tells you that you have to visit a radiologist for these scans time and again, please don't be disheartened. The doctor is actually trying to navigate through your journey of menstrual cycle and trying to give her or his best shot for you to achieve your parenthood. Thank you so much for patient hearing.